different models. There are about 6 different models. They're all funded differently. The sources of funding are slightly different, and they're funded at different levels. So it's kind of a complicated answer, but we can probably get that to you if you give Lindsay your card. Right. But just to give you an example, so we have one model called Scattered Site Supported Housing. A provider gets an annual stipend per person. So for that stipend, they have to pay the majority of the rent, the majority of the utilities, staff, administration, computers. Everything has to come out of that stipend. In Syracuse, that stipend is $7,700 per year, per person, for everything. In Western New York, it's about $8,600. In Long Island and New York City, it's $16,500. So in New York City, $16,500 barely covers the rent, let alone the staffing and everything else that you have to do to make sure that you're taking care of people to the level that you need to take care of them. And the interesting thing about that is that the Office of Alcoholism and Substance Abuse Services, a sister agency to the Office of Mental Health, they pay $25,000 per year in the city for that program, whereas OMH pays $16,500. And New York City pays $30,000 a year in the AIDS program that they run, which is like very similar. These are all almost identical programs. So of all of the state agencies and all of the types of populations that benefit from supported housing, only OMH pays these very, very low rates, the Office of Mental Health. And it's almost impossible now for the providers like Ralph and other providers who are here today to make that work, to make that money work.
So how much would adequate funding cost? What would be the funding increase over this currently?
So we're not specifically going to give you an overall number. There are a number of ways we can go about this with the state. For example, right now, if an agency in New York City has a contract for 100 beds and they get $16,500 per person, they're really not able to serve 100 people with that amount of money. So they end up serving maybe 95 people or 90 people or 85 people, depending on what the rental market is like. So we're losing beds on a regular basis. But we can have a conversation with the state about how we want to manage that. And maybe we want to decrease the number of beds at some point if they're not willing to add more money. So there's a number of ways that we could talk about this with the state of New York. So we're not at the point where we're going to just put out a number at this point.
Well, the governor said that the state has a $4 billion deficit coming up. How are you going to get more money out of the state if there's that big of a hole?
Yeah, well, I think it's interesting in New York because whenever there's an issue that is that affects the governor or that he really wants fixed, he is able to come up with the money. They always seem to be able to come up with the money. And our providers and our programs have been underfunded for so many years. In bad times, we're told we don't have enough money for you. In good times, they tell us to wait a little longer. And we wait and we wait and we wait. And frankly, we've helped the state keep the budget to where it's been these last 8 years. The governor came in, he imposed the Medicaid cap. Some of our programs are Medicaid reimbursed. We've gotten no increases, so we've actually helped the governor keep the Medicaid cap under control. And at some point, I think you can't just keep us flat for year after year after year. We're not going to be able to do the services. These are the state's services that they ask providers to do. This isn't something that we thought was a great idea and we just started doing this. The governor's office puts out RFPs, requests for proposal, asks providers to respond. They respond, but they're not keeping the funding to where it needs to be. So, I mean, without coming up with an actual number, whatever number we come up with, it's a rounding error in the state budget. It's really not. I just don't believe the $4 billion deficit should impact this.
But have you had any indication from the governor's office that they're even willing to talk about this? Because they put out this budget letter that says 0 increase for the agencies and $4 billion budget. I mean, it doesn't sound like he's in the position or in the mood to give any money to anyone this year.
Well, we're going to push it. We're going to push the issue as hard as we can for the next 6 months. So I am hoping that he will come around.
Have you guys been in contact with the legislators trying to get any sort of bill numbers or trying to get anyone kind of backing you guys?
So we're just starting. This is our kickoff. So we do have meetings already scheduled out for the next 3 weeks or so. And we do know the chairs of the Mental Hygiene Committee, and we know all the legislators on the Senate and Assembly Mental Hygiene Committees. We'll be talking to all of them. We'll be talking to the governor's office. We'll be talking to Ways and Means in the Assembly, Program and Council in the Senate. So we will be having all of those meetings in the next few weeks, and right through till till the end of March. So we're hoping to get a lot more supporters, but this is the first day.
Are you looking to change the way that they go about doing the increases for the funding every year, or are you just asking for like a lump sum of donation for this service?
Oh, probably both.
Okay.
Yeah, you bring out the problem. We have operated residences for many years with no increases, and it's impossible to do that. Utilities go up, insurance goes up, salaries go up, and we're still running residences with no increases. It's just impossible to do. So some providers are now saying, we can't do this anymore. We're going to have to give back programs. So we've reached a real critical point that needs attention now. And in answer to the question, where does the money come from? We saved the state a lot of money by taking people out of expensive institutions, by reducing Medicaid costs, and by reducing homelessness. So that's where the money needs to come from.
There you go.
Thank you. Thank you, everybody.
He is now. And he's with Scarlett.
Good morning, everybody. Come here, Scarlett. Sit down. I'm here today as an example to voice my personal experience to show how important and crucial it is to have these funds and have them increased. Myself, my story, like many others, is unique, and I had a life-changing experience twice in my life. Once when in 2001, when 9/11 happened, I had joined the Marine Corps in March of 2001, and 6 months later, 9/11 happens. With that said, we went to war and everything, and I come home, and I find myself having trouble, with many things, and one of those things was housing. I went and got help. Finally, after 10 years of being out, I went and got help at the VA, and found myself, and at that time I had a fiance who passed away from a brain aneurysm at the time. So with that and the eviction I had, I was homeless, and I was homeless for 6 months. So without this housing, I really, I don't know where I'd be today. They really helped me a lot, and it's really important for myself and for other veterans and people that need this. Thank you.
Thank you.
I love her to death. She's a great mom, but she had a hard time losing the love of her life. She also had a hard time supporting 3 kids. So when I got sick, she didn't have the financial money to support me and help me recover. And I didn't have health insurance, which health insurance is another issue for another day. But I ultimately ended up, on the streets and not doing well. She ended up getting me into a mental health agency, housing through case management, and with the help of that, called Aid to the Developmentally Disabled. I lived in that housing for 6 or 7 years, and a good portion of that was spent in the community residence, which is 10 people to 24-hour supervision, 10 people living in the house. And turnover was horrible, which impeded the recovery of many, and still does. And just not a happy housing situation to live in. I finally got to the point where I was like, I can't do this anymore. I need to do something. I need to change my way. Because if I didn't change my way, if I didn't get secure housing, I didn't find a place where I was living in happily, then I probably wouldn't be speaking here today. But with the help of my friends and family and support like Niagara's from Harvey, I was able to eventually move up through the levels of housing, where I ended up in the highest level of housing, and then I got my Section 8 voucher. Housing is, without housing, without having a stable home, which I didn't for years, I wouldn't be here today. I wouldn't have my own place. I wouldn't have my lovely dog. I wouldn't be working with animals. That's what I do. I don't work in the field. I volunteer. I'm an advocate, but I actually professionally work with animals. Housing is crucial to all that. I wouldn't be able to do what I do without having a stable home to go to. Thank you.